Good morning. So today is Sunday, May 13th. My gastric bypass is tomorrow, May 14th. And I am here to show you what's in my hospital bag. So I have got this bag I'm going to take with me to the hospital, and I'm going to show you what all is necessary for you to pack to go to the hospital. I got most of my ideas from watching a zillion other weight loss surgery patients on YouTube and what they packed and what they actually used, etc. But there may be a couple of different things. We'll see. Okay, so I'm gonna start with the empty bag. Let me get everything else out of here and we'll pack my bag. Okay, bag is empty. So I'm gonna start with so when you're in the hospital, you are going to be wearing a hospital gown and hospital socks and whatever they allow you to put on. Thank goodness I'm not on my cycle, because that would be one more thing I'd have to deal with. I was scared of that, and thank goodness that is not the case. So they want us to walk right after surgery. My surgery, I'm going to show up at 10:30 in the morning. Surgery is 12:30. And I should be in my room recovered by that evening. So that night they want me up and walking. So I have my own slippers with the grip bottoms so I don't have to wear those ugly hospital socks. And the SCDs, so they put these SCDs, which are like squeezing boots, on your legs when you're in the hospital. They also give you a blood thinner shot, Lovenox, once right before surgery, once right after surgery, or that evening, whatever, and then once in the next morning. But that's all to prevent blood clots. But it's really important that you be walking. Your body is supposed to be walking. You're not supposed to be sedentary, so you don't get those clots. Another thing that helps with the gas pain is the walking. So you may have heard that they pump your stomach full of this carbon dioxide to pump your stomach up to give them room to see things. So you want to make sure that you get all that gas out. Otherwise, you're going to have tremendous shoulder pain and intestinal pain and all this other stuff. So, walking. So I have my slippers. Also going to need a robe so I can be covered up. It's a thin, summery robe, not a big deal. And then I don't want to be in the hospital gown if I can help it. So the second that I'm allowed to walk around, I am going to take that hospital gown off and put on this little nightgown that has access to my IVs. There should be no reason for them not to allow a nightgown, and they can pull it up to look at my incisions. Okay, it's just like a night shirt. It's not very long, so they can look at my incisions. But those hospital gowns are not going to be very comfortable to sleep in, so that's why I wanted to wear this. You don't have to pack everything that you use at home. You are going to the hospital. They do have stuff for you to provide for you. You don't have to bring clothes. You can go in a hospital gown and their footy socks, okay? This is my choice. So I also have a shirt that I will show you when I'm ready to leave the hospital, but then I have some pants to go with it. They are very loose at the waist pants, so they shouldn't affect my incisions. What I don't have in here that I'm going to need is a sports bra, so I'm going to remember to get that. I have to have a sports bra because I'm not going to want to wear this bra with these underwires that will sit on no doubt 3 incision sites. Okay. Also, so when you're in the room, everyone knows you're going to have your phone, right? You're probably not going to feel up to watching TV or talking much, but I want to make sure that I have my phone charged and my tablet charged. So I'm going to bring my tablet. I'm going to bring my chargers. Along those lines, I have been told to also bring a small extension cord because your phone won't reach from the wall to the bed. Okay. For the bathroom, in terms of bathroom stuff, I know that I am not going to feel like taking a shower. So they've given me soap that I have to use tonight and then in the morning, chlorhexidine wash. And so I'm going to wash down with this. So I'm going to be clean tomorrow morning. And I'm going to go to surgery clean. When I come out, I'm only going to be overnight. Okay? Hopefully, only overnight. I am not going to feel like taking a shower. They say you're probably not going to feel like that for 2 to 3 days. So I'm not packing shampoo and conditioner and soap like everybody is in other blogs I've seen them bring. I'm not bringing that. This is staying out because I'm going to use it tonight. But what I do have is some feminine wipes. Make sure to keep things clean and smelling fresh. I do have my my contact lens solution and a contact lens case, a deodorant, and toothbrush and toothpaste. Okay? One other thing that people said you absolutely have to have, and I am not a chapstick person. I actually sell lip scents, so I have their gloss, but everybody said to bring chapstick. I may not even use it, but if I can't find my gloss, which is in my purse, and I forget to use it, I do have a chapstick that was laying around, so I just put it in there. It's there if I forget my gloss. Alright, so that's my bathroom stuff. Goes in the bag. I am not sure that I'm going to feel like putting on makeup, but I'm pretty sure I'm going to want to put on something. But I know at the bare minimum, I'm going to want to wash my face. So I'm going to scrub my face at night, and they don't want you to wear makeup in the morning, but I will probably put some on the second that I'm awake enough to vlog a minute. But then I want to make sure that I keep up my skincare at least. So I have my skincare products in here, and then I also have some makeup and stuff in this little makeup bag. I don't think there's anything special in there except makeup. So I've got this one labeled makeup. And I did bring a little mirror because I'm not going to want to get up to walk to the bathroom to put on some lipstick or whatever. I also have because I wear contacts, I can't wear my contacts to surgery, so I'm going to have my glasses and a glasses case. I'm on a liquid diet today because tomorrow is surgery. So I'm trying to stay very hydrated. I also have this spray that smells good. They said the hospitals smell gross and it can affect your nausea. So I wouldn't suggest something very perfumey, but this is just a little light peach scent. So just takes out that hospital odor maybe. So I am going to bring that with me as well. Your skin is very dry. Hospitals are very dry. So I'm just bringing some hand and body cream. Gastric. So these are the strips. Now I could not find these at Walmart. I went to Walmart and to Rite Aid and I couldn't find them. So I had to order mine on Amazon, but I did order them on Amazon. But that's for those gas pains that you can get after surgery. Now, they want us to bring all of the medicines that we take. All the medicines that you take. Look at this. Y'all, wait till I do a vlog on vitamins because I am ready. Okay? But they want you to take all the medicines that you take, so your prescriptions, so that they can write them down, have a real record of them. But I do have them written down also. I went to pre-admission already, so they've already taken my medical history and my medicines. They've already written them all down. They did my blood typing and everything on that day, but I have my home prescriptions. I'm not going to be taking my medicines at the hospital. They've already told me that I'm going to be discharged before I would have to take my meds. So I will bring them with me just like they've asked, but I haven't put them yet in the bag because I'm going to take them tonight. So but I am ready for the days after, so with my vitamins and stuff. So I'll do another vlog on that. This is just what I'm taking for the hospital. Oh, very, very, very important. They told me that I have to bring so this is the folder that I got from my surgeon, and it has all the information on bariatric surgery and what to expect. This is the same-day surgery guide for New Hanover Regional Hospital, and it gives information about doing the shower and how to show up that morning, whatever. These are my instructions, post-surgical instructions, and where to show up for my surgery, and a map, because I'm not going to be driving. It's going to be my mother who's actually driving me. You had to have somebody pick you up, so that's fine. So she's going to come. So I have a little map for her, and then this says what procedure that I'm having and my current weights and stuff. So all that stuff they want me to bring. So those papers going in my bag. The only other thing that you would need is your driver's license and insurance card, and a debit card or something if you're going to be needing something, but you're going to be NPO you're not going to be able to eat any food, so it's not like, people are going to be buying you stuff. They have Jellos, they have sugar-free Jellos, so you don't have to bring your own Jellos, you don't have to bring your own waters. I am probably going to bring a couple of protein mixes for my fluids. If I can't start that at the hospital, that's totally fine, but I want to start getting in the habit of drinking water with protein in it almost immediately, because I am very afraid of getting malnourished and not getting enough calories, and also not getting enough water. So I need to make sure that I'm doing all of those things from the very first day. Okay. I hope I didn't talk too fast. I know that I did. It's already a long video. It's 13 minutes. But my hospital bag is ready to go. I'm ready to go. I'm a little bit nervous. It's getting real. But I leave tonight to go to my mother's house, and she will take me to surgery. So I'm excited for the first step of my new journey. And I will see you guys from the hospital.